What is leukemia? The cancer is a disease that can start anywhere in the body, begins when cells grow uncontrollably surpassing normal cells, which makes it difficult for the body work properly. The leukemia is cancer in the bloody tissues, including the bone marrow and the lymphatic system. There are many types: acute lymphoblastic leukemia, acute myeloid leukemia, and the chronic lymphocytic leukemia. Many patients with types of slow devolving leukemia have symptoms. Some forms of leukemia are more frequent in children, others take place mainly in adults.
Sometimes the symptoms of leukemia are non-specific, and they also vary by the type of leukemia, but the most common symptoms are fever and frequent infections due to decrease and alterations of white blood cells, tiredness and fatigue, tiredness or fatigue, shortness of breath, weakness, and palpitations may occur due to decrease of red blood cells. Bruises due to the change in platelets. And other symptoms may be bone pain, swelling of the spleen or liver, and you may also notice loss of weight, appetite, and these signs. So, if you have any symptom, you should see your doctor. Thanks.
My name is Luis and I'm here to talk to you about the causes. The causes of leukemia aren't exactly known, but we know that there are many factors that can provoke the appearance of this disease, like genetics, immunodeficiencies, or environmental factors. With genetics, well, we have twins. Twins are more propense to develop Down and Fanconi syndromes, and these two syndromes are related with the appearance of leukemia. With immunodeficiencies, well, people with weakened immune system due to administration of chemo, and this is gonna be difficult, immunosuppressor drugs immunosuppressor drugs are more susceptible to develop leukemia. With the environmental factors, we've got pollution, chemical substances like benzene, ionizing radiation, viruses too, and guess what? Pesticides too. And these are some of the causes of leukemia.
Treatment depends on the patient's state of severity. Treatment varies considerably. For slow-growing leukemias, treatment consists of medical checks. For aggressive leukemias, treatment includes chemotherapy, followed by radiation therapy and stem cell transplantation in other cases. Chemotherapy. You can use anti-cancer drugs, which you must inject into a vein under the skin or into the cerebrospinal fluid, or thus that can be taken by mouth to destroy or control cancer cells. A bone marrow transplant, also called a stem cell transplant, is a treatment for some types of cancer. For example, a transplant could be performed in patients with leukemia, multiple myeloma, or some types of lymphoma. When treatment ends, the patient can receive an infusion of blood-producing stem cells to restore the bone marrow. The blood-producing stem cells used for a transplant can be obtained from either the blood or the bone marrow. Sometimes, stem cells from a baby's umbilical cord blood are used.
To date, there is no way to prevent leukemia. Experts advise lead a healthy life without toxic habits, valid recommendations also for the prevention of other oncological disease, and they will also help to face in better conditions the treatment that this type of cancer requires in the event that it develops. In case of having the disease, the following is recommended. But the symptoms and treatment of leukemia can cause vomiting or discomfort, which can use loss of appetite. You should go to the doctor to suggest a series of guidelines to meet nutritional needs. Once treatment is completed, the patient must maintain rigorous control examinations. These exams help to control any change that arises in the patient's health, possible relapses in the pathology, or damage caused by the treatment itself. The impact of being diagnosed with leukemia for the patient can affect their mood. You should seek support, but the medical team that accompanies you and in groups or professionals who can provide psychological or emotional help.